I'm here.
Blessing, share your screen.
Hello, Prof.
Yes, who is that?
Prof is Gift, okay? I've been
You
used.
say who?
Gift, sir. Number 3.
I'll pass you now. When I pass you, I've passed you. Until I get to the end, I'm not coming back.
I'm sorry, sir, please. I didn't know that my name was not showing.
Yes, sir. Please also favor in. I was slated for 10:30, sir.
Hold on. Put on your video, favor.
Good morning, sir. Aisha is online, sir.
Aisha, listen to me.
Okay, sir.
I'm looking at the topic. What did you study in your first degree?
Banking and finance, sir.
Then you did PGD in public health.
Yes, sir.
Where did you do the PGD?
Uniport, sir.
All right. So look at your topic: knowledge, attitude, and practice of antibiotic use. What is practice of antibiotic use? Don't understand what you mean by practice of antibiotic use and self-medication. And antibiotic use is prescribed for you and you swallow the medicine at the prescribed time. What do you mean by knowledge, attitude, and practice of antibiotic use? What do you mean? What do you understand by this topic?
Okay, the use of antibiotics and self-medication among adults. Use of antibiotics.
What is your concern there? What is your concern there? Is it antibiotic abuse or misuse? Yeah. Which one? Antibiotic abuse or misuse?
Misuse and abuse. Abuse and misuse.
It should be reflected in the topic now. Self-medication is a different thing. Why are you combining the two? Because me, as a doctor, I can encourage antibiotic misuse by prescribing an antibiotic for a viral infection, by prescribing antibiotic for a protozoal infection, or even for fungal infection. It's antibiotic misuse. So, which one are we talking about? I know that they gave you this topic, but the topic seems not straight with me. Do you understand?
Yes, sir.
Something is not right with the topic as it is.
Prof, if I may suggest, sir.
Yes.
I think
Osai, I'm listening to you. Osai.
Oza will be able to watch it.
Hello, who is talking? Is it Osai or Bala?
Yes. Osai, Prof.
What did you say?
I said, let's give a blind eye to the topic. Allow her to do the presentation first. Let's see what she wants to present. If the thing is making sense, from there, the topic can be modified.
Okay, go ahead.
Background information. Antibiotics are essential for treating bacterial infections and preventing complications. Inappropriate antibiotics use accelerates antimicrobial resistance. So antibiotic misuse and self-medication are widespread. Antibiotics misuse contribute. The aim is to assess the knowledge, attitude, and practice of antibiotic use and self-medication among adults in urban communities in Rivers State. And the objectives are: 1, to access knowledge of antibiotic use among adults; 2, to determine attitudes towards antibiotics. The study area and the study design. The study area is in Rivers State, Nigeria, Niger Delta region. It's highly urbanized with dense population, especially study population. The inclusion criteria is adults age 18 years and above, residents, people who reside in Port Harcourt. Sample size determination.
How did you come by this? How did you come by this? The P, which is 50.4, where is it from? What is it all about? P is the prevalence or proportion of the attribute of interest that is present in the population. What is your P? Is it proper use of antibiotic or proportion of rural dwellers who are into self-medication? Which one are you talking about for your P? And then how did you calculate and get the 384? And then how did you change to 442, 422? Next slide.
The sampling method, multi-stage sampling technique. The stage 1 is selection of urban local government areas in River State. Then the stage 2 is the random selection of urban communities. Then stage 3, identification of community.
Are you in River State? Are
Yes,
you from
sir.
River State?
No, I'm not from River State, but I reside in River State, sir.
So what do you know about River State? Why are you selecting urban communities, local governments? Is the topic about urban?
Yeah, among adults in urban communities.
Okay, fine. So how do you, it means that you have to stratify the state into urban and rural now, so that you now pick from the urban now. I want to identify the urban local governments. And which one are the urban local governments?
Port Harcourt, LMA, Okrika, that's Okrika.
It's not true. It's only Falga and Obiakpor that are urban. All the rest are rural.
Okay, sir.
All the rest are rural. Next slide.
Okay. The study instrument, the type of study is a structured questionnaire with 5 sections. Then the administration method, face-to-face interviewer, administered questionnaire.
Next slide.
Data management, data reliability and validity plan.
You didn't do anything. You just put validity. What are you going to do? You are going to do a pretest on the population of how many people? At least 30. The reliability, use Kroback alpha test. 7 greater than or equal to 7.7. All right. So which they are going to use WinPepi for your data analysis. All right. So how are you going to present your chi-square test? Significant level is 0.05 or less. Are you hearing me? Equal
Yes,
to or less than 0.05. Next slide.
And the ethical considerations, permissions are prepared from University of Port Harcourt Ethics Committee. Then the consent.
Next slide. See, go back. No, don't go there now. The ethical issues is what we are looking at.
Okay,
the understanding is very poor. University does not give you permission. The university gives you ethical clearance or ethical approval. So that last one that you did not write anything, that's where you should get the first one. That ethical approval from the ethics committee. That's ethical clearance. Then since you're doing a community-based survey, you must get permission from the community leaders, TDC or traditional rulers, to enter community and do your study. Then you get informed consent from the participants. Bala, I will log you out if you don't stop making noise, Bala. Mute your mic, Bala. Bala, mute your mic. Now let's see your references. Let's go back to your title slide. Knowledge, attitude, and practice. Even after your presentation, I didn't see the direction you were going. Are you hearing me?
Yes, sir.
Even me too, Prof. I tried to crack my head to see if I could be able to change the topic, but
If you are talking about
the whole thing is not
antibiotic
making sense. Yeah.
stewardship, if you are talking about
Mm.
antibiotic stewardship, then we know that it's among prescribers. If you are talking about antibiotic abuse, fine, that one could do. Knowledge, attitude, and practice of preventive measures against antibiotic abuse amongst adults in urban community in River State. Knowledge, attitude, and practice of preventive measures against antibiotic abuse. I can understand. But if you are looking at self-medication among adults in River State, that's another topic altogether. Do you understand? The two, I don't see how they come together. There are two topics in one. So if you're looking at self-medication amongst adults, then we'll look at what proportion of adults are into self-medication. What drugs what condition do they commonly use self-medication for? And what is the effect and outcome and that kind of thing. But if you're talking about antibiotic abuse, we want to look at adults, whether they have knowledge about prevention of antibiotic abuse, the attitude towards preventive measures, and the practice. I can understand. Who is your supervisor? You don't have any.
Yes, sir.
All right, so let us assume that you want to look at knowledge, attitude, and practice of prevention of antibiotic abuse amongst adults. So now let's go to the next slide. You did not, the background didn't say anything. This is an academic writing, and it's about research, and you did not cite any source of anything. That antibiotics are essential for treating infections and preventing complications, fine. Who said so? Where did you get it from? Inappropriate use of antibiotic accelerate antimicrobial resistance. Yes, fine. Where did this one come from? You didn't tell us anything. You have written fine, but you did not cite sources. Next slide. Now, this is the main reason for the study, statement of the problem. What problem did you identify? Antibiotic misuse. Misuse. Self-medication, widespread in Nigeria. Give me data. Prevalence of self-medication from this. What about prevalence of antibiotic misuse? You didn't give us. The problem must be stated in magnitude and effect, because this study is to find solution to that problem. And if there's no problem, then what are you doing to solution? Whatever problem you identify must. So if you are talking about knowledge, attitude, and practice of proper use of antibiotics amongst adults, knowledge, attitude, and practice of proper use of antibiotics, here you are talking about antibiotic misuse. So we can understand. Next slide. Justification. Antibiotic misuse contributes to significant microbial resistance. Fine. Understanding community knowledge. It's not community knowledge, it's individual's knowledge. Existing Nigeria, there's focus mainly on students or healthcare. Tell us those studies. You didn't cite any. Next slide. So let us look at your aim and objectives. So this is where the problem is. So what are we choosing? Is it knowledge, attitude, and practice of proper use of antibiotics amongst adults in urban communities? Or you want to assess self-medication amongst adults in urban community in River State? Choose one so that we frame your objectives for you. I want to believe that it's antibiotic you're interested in. So to assess the knowledge, attitude, and practice of proper use of antibiotics, amongst adults in urban communities in River State. Or knowledge, attitude, and practice of preventive measures against antibiotic misuse. misuse. So objective 1, assess the knowledge of proper use of antibiotics amongst adults in urban communities in Rivers State. Ascertain the attitude of adults in urban communities towards proper use of antibiotics, and then determine the level of practice of proper use of antibiotics amongst adults in urban communities. And then if you're interested in self-medication, if you want to bring it in, fine. But when we're talking about use of antibiotics, it should actually be among prescribers, because they are the people prescribing. So if you're talking about knowledge, attitude, and proper use of antibiotics amongst clinicians who make prescriptions, which should be ideal, because we are the people who prescribe antibiotic for viral infections, antibiotic for protozoal infections, antibiotic for fungal infections, which is wrong. But if it's self-medication, then you go and buy whatever you like and you use. So that is where we are. Knowledge, proper use of antibiotics, attitude. The general public is not likely to have good knowledge about this. All they know is that they are not well and they should take any medicine that will make them get better. That's why they buy medicine from boss. They buy medicine from native doctors parading the streets. That is the thing, is their lack of knowledge. So you can't blame them. But the people we should blame are me, doctor, who will prescribe antibiotic for viral infection, antibiotic for protozoal infection. Do you understand? And
Yes,
here
sir.
are you back?
Yes, sir.
Dr. Somiari. So where are we?
Looking at the objectives.
See what we're going to do. See what we're going to do. We'll step you down. Yeah, I've commented on all your slides.
Yes, sir.
Methodology, we have commented on it. Is the topic and the objectives. So make up your mind and call me. I will streamline them for you. Whether you want to do self-medication or proper use of antibiotics. Do you understand?
Yes, sir.
All right, stop sharing. What's
Thank
your
you,
number?
sir.
What's your serial number?
Number 8, sir.
Number 8?
Yes, sir.
Good morning, sir.
The blessing, okay. Determinants of use of antibiotics.
Good morning, sir.
Wait, blessing. This topic is different from what you are presenting now. What you have here is different from what you are presenting. Determinants of use of antibiotics amongst adults. That's what your topic is. What you are presenting is different. Reshare your screen, let's see. Reshare your screen, blessing.
Yes, sir.
This is not the topic now. This is not what they gave you. What they gave you is determinants of use of antibiotics. Are you hearing me?
Yes, sir.
You want to change it and cause problem for us. See the topic they gave you. Blessing. 8. Where's your serial 8? Determinants of the use of antibiotics amongst adults in Rivers State. That's what they gave you. Is it not so?
Yes, sir.
So why did you go to change it?
Okay, so when I submitted my topic, this was the topic I submitted. I think they modified the topic. Okay, I should have.
They chose one for you. Wait. You submitted topics and they chose one for you. So why are you rejecting what they gave you to go and do what you have in mind? Let me tell you something. When we ask students to submit topics, we know that some of them will submit topics of finished work so that they will go and copy. We don't allow that. We adjust the topic so that it will be a fresh study.
Okay, sir.
So now they adjusted their topic to determinants of use of antibiotics amongst adults. You have rejected it. Now go back and rewrite your work on that topic and come back. I'm giving you 2 days.
Okay, sir.
Stop sharing.
Thank you, sir. Thank you very much, sir.
Thank you for what? For being disobedient?
No, sir, for putting me in the right direction, sir. I'm sorry.
No, the direction was there. You rejected it.
Yes.
I beg.
Iwu, are you there? Iwu. Iwu, are you there? Serial number 9. Registration number 287. Iwu, are you there? Iwu. Promise. Caroline, are you there? Promise, Caroline Alange. Promise, Caroline Alange. I hello Chinoye Rosemary.
I'm here, sir.
Rosemary,
I'm here,
shout.
sir. Okay, sir. So I'm sharing now, sir.
Yes. I've seen it. Show your video.
Good. Good morning, sir.
Start.
Good morning. Okay, sir. So my topic is uptake and determinants of hepatitis B vaccination among health workers in University of Port Harcourt Teaching Hospital.
Hold on. Are you a doctor, a nurse, or an admin
Yes,
staff? What
okay,
are you?
I'm a nurse, sir.
So why are you pronouncing hepatitis B as hepatitis B? It's hepatitis B, not hepatitis.
Okay, sir.
Yeah, health worker, and you're doing this. Let's start. Start.
Yes, sir. I don't know why it's not moving. Okay, background information. Hepatitis B virus, HBV, remains a severe global health threat, particularly in hyper-endemic regions like sub-Saharan Africa and Nigeria, driven by systemic inequalities and fragile health.
Hold on. You see, we have credit in English. That's why they gave us university admission. Now you say sub-Saharan Africa and Nigeria. Is Nigeria not in sub-Saharan Africa? It's Nigeria not in sub-Saharan Africa.
It is, sir.
Rosemary.
Yes,
So
sir, it is.
Like that. That's not good. Please continue.
Okay. So healthcare workers, they face a continuous occupational hazard due to HBV's high transmissibility through blood and bodily fluids.
See. Wait. See this. See the reference here, the 1996. In 1996, how old were you? 1996 is 30 years from now. 30 years ago. How old was Rosemary 30 years ago? They're giving me a reference. 30 years ago, then 20 years ago, and this is 2026. That is very bad. Very bad.
Noted, sir.
And you're even taking another one, 1993. Next slide, please. It's not good.
Problem
Next
statement.
slide. Yes.
Oh,
Go ahead. Problem statement. Go ahead.
okay.
State the problem. There
Okay.
is no
Despite
problem here. I cannot see any statistics of hepatitis B infection rate and the consequences of hepatitis B infection rate with regards to liver cancer and other things. There is nothing here. You have stated no problem. Next slide.
study justification. While previous Nigerian studies highlight low HBV vaccine uptake, many are outdated and may not reflect the post-COVID-19
Because
realities.
you have used outdated data. Even you don't even have any current data. You yourself, you don't have any current data. You're using 30-year-old data. Next slide, please.
The aim of this study is to assess the uptake of hepatitis B vaccination and identify its determinants among health workers in the University of Port Harcourt Teaching Hospital. Objectives: 1, to determine the proportion of health workers at the University of Port Harcourt Teaching Hospital who have completed the full 3-dose course of the hepatitis B vaccine. 2, to assess the level of knowledge regarding hepatitis B virus infection, its transmission, and prevention through vaccination among health workers at the hospital. 3, to evaluate the attitudes and risk perception of health.
Next slide.
Study area. The study will be conducted within the high contact clinical departments of the University of Port Harcourt Teaching Hospital, which is located in Port Harcourt, Rivers State, and it serves as a major referral.
What do you call high contact clinical department? What do you call high contact clinical department?
The teaching hospital is made up of different departments, and for this study, our focus is
high contact clinical departments,
where the staffs who are there are in close contact with
Rosemary,
infected patients.
I don't like your English, Rosemary. I must confess, your English is very bad. Staff is an uncountable noun. Therefore, you cannot say staffs. Okay. Staff is an uncountable noun. So it is wrong to say staffs. Do you hear me?
Yes, sir.
So if your child makes that mistake, you can't correct the child because you yourself, you don't know the right one. You know why you're in this school? You're in this school because you have credit in English, but you're not justifying it. So what do you call high contact? All clinical departments are involved in activities apart from pharmacy. Apart from pharmacy. Are you hearing me? And maybe physio. I don't know. All other clinical departments, surgery, medicine, public health, whatever. Even public health, even is worse because every day they run immunization clinic. So they give injections. Pediatrics, they always find in line or something. So which one are you talking about? High contact. What do you mean by high contact? All right, so go on. Study design.
The research will utilize a quantitative analytical cross-sectional study design.
It's nothing like quantitative cross-sectional. Can be analytical cross-sectional design. No problem.
Okay.
Next slide.
Study population. It comprised a diverse group of approximately 1,200 clinical health workers, including medical doctors, nurses, laboratory scientists, and allied health professionals currently employed as UPTH. Inclusion criteria.
Hold on. Those who are in admin, they might not be involved in activities like venopuncture, phlebotomy, giving IV or IM injections, as the case may be.
Yes, sir.
So describe those ones that are involved there. Will be a registered and currently employed clinical health worker. What do you mean by registered? What do you mean by registered? Does the hospital employ clinicians that are not registered?
No, at least we exclude students.
I'm asking you, students are not there.
No, sir.
Students are not there. Minimum of 6 months. Consent is not an issue. You have already said clinical workers, so non-clinical staff is not Anybody you want to exclude must be included. The non-clinical staff are already excluded, so they can't be there.
Okay, sir.
The leave is not the issue. When you go, it's those you see that you are going to take. What do you call extended leave? People who are unable to provide meaningful or voluntary, that's not issue. So one must be a frontline clinician. Frontline clinician. In other words, the activities involve taking blood samples, body fluids, and whatever required for patient diagnosis and treatment. So must be a frontline clinician, must have been employed for at least 6 months in the hospital. Are you hearing me? Those are the two criteria. The other one is those who are too ill to participate. Next slide. Next slide. Sample size determination. What did you calculate? What is your P? 42. What does P 42 mean? Those who are fully immunized, clinicians, or what?
Yes, sir.
Is what? No, tell us what it is now, because you see, when we give the sample size formula, N equals Z squared times P times Q all over D square or E square, Cochrane formula. What is N? Sample size. Z, standard normal deviate, which corresponds to 1.96 at 95% confidence level. What is P? P is the prevalence or proportion of the attribute of interest that is present in the population. In this case, portion of health workers that are fully immunized for hepatitis B. Are you hearing me? Q is 1 minus P. Then E is accuracy or precision. So that's how you're going to give that before you now do the calculations. So now you have done their calculation. What did you get?
417 health workers, sir.
All right. Are you going to do multi-stage sampling? If you're going to do multi-stage sampling, you are going to provide for the design effect. Can increase the sample size by 50% or 100%. Next slide. Sampling method, multi-stage. So design effect is required in your sample size determination. So first stage, what are you doing? What are you doing first?
I'll randomly select 5 out of the 18 major clinical departments at the hospital.
So why are you talking cluster sampling? Why are you saying cluster sampling? There are 18 departments, fine. So you are selecting 5 out of the 18. Is that what you're saying?
Yes, sir.
By what sampling method? Simple random sampling method of balloting or what?
By simple random selection, sir.
No, simple random sampling method of balloting, or you are going to use a table of random numbers. What are you going to use?
I'll use ballot system, sir.
All right, so 5 departments. Stage 2, what do you do next?
I will now have to categorize them.
This is stage 1, stage 2, stage 3, stage 4, as the case may be. So after selecting the department, what do you do next?
I will now categorize the clinical workforce into the different professional cadres, including like the doctor.
In other words, in each of the selected departments, you are going to stratify them into their clinical professional cadre. That's stratification of this clinical staff in the department to different professional cadre. All right, so you have nurses, doctors, whatever. But you know that the lab scientists and technicians are not in any of their own department. There is no other person there. In surgery department, there are nurses, there are doctors. In all the clinical departments have nurses and doctors. But in pharmacy, there is no nurse, there is no doctor, only pharmacists. In the lab, there is no doctor, no nurse, only lab people. So what are you going to do there? Those ones will stand on their own in case you select them.
Yes, sir.
Yes. So now you do what? Proportionate to size allocation of sample size. to
Yes,
each
sir.
of the people in the strata.
Yes,
Then the
sir.
next one is to select the subsample for each stratum using system random sample method of balloting or systematic sampling. So you should have at least 3 stages. Next slide.
Okay, the study instruments. I'll be using a structured interviewer administered close-ended questionnaire.
See, I told you that I don't like your English. Studying tools are structured, semi-structured, or unstructured.
Okay.
A structured questionnaire tool means that all the questions are close-ended. So when you say a structured interview administered close-ended, it's tautology.
Okay.
It's tautology. In a structured questionnaire, all the questions are close-ended.
Mm-hmm.
Am I wrong to say I don't like your English? Next slide. Continue. What are the sections of the questionnaire?
Okay, we have section A will be the socio-demographic and professional data. Section B will be to test their knowledge on hepatitis B. Section C will assess
Okay,
attitudes
so
and risks.
let me help you.
Okay,
If you are
sir.
looking at barriers, we are saying objective 3 and categorical queries to determine vaccination status and institutional barriers. Objective, I don't know what you mean. So you have a section A, social demographic characteristics, section A. Section B is occupational history.
Okay.
Occupational history. What is your specialization? How long have you worked as a doctor, as a nurse, as a lab scientist? What are your daily routines in those places? Do they involve giving injections, taking blood samples and tissue samples or whatever? Are you hearing me? That's occupational
Yes.
history. The third one is knowledge of the importance of hepatitis B and its virus and its preventive measures. Attitude. The third one is the uptake. Are you hearing me?
Yes, sir.
So if you're interested in barriers, then you have to do a mixed method. We have a section, an additional objective on facilitators and barriers to uptake. We are going to collect that data using qualitative data collection methods, maybe focus group discussion. To say why it is easy to take the vaccine or it is not easy to take the vaccine. Why people have taken, some have not taken. Do you understand?
Yes, sir.
All right, next slide.
Data reliability and validity plan.
This was, come, everybody look at this woman's slide template. This was what was given to you by the school. This was what was given to you by the school. People can use all manner of things to put there. Data reliability, yes, and validity. It's actually not data reliability, it's instrument, it's the data collection instrument. How reliable or valid is the data collection instrument? It's not the data itself, it's the instrument.
Okay, sir.
So you cannot do a pilot test, it's a pre-test. A pilot test is a complete test, a complete project or complete study from beginning to end on a small scale. Here, we want to validate the tool, whether all the questions mean the same thing to everybody. So we'll do a pre-test on a sample of 10% or a minimum of 30 people in another location so that we'll take away ambiguities. Chromback alpha test, fine, I agree with you, 7 or more. Data entry plan, how do you, next slide. What are you using to assess, to analyze the data? Which statistical software? Where is it?
SPSS.
Which version are you using? It's not there.
Version
You cannot test
27.02.
hypothesis because you did not formulate anyone. And this study is a cross-sectional study. So it lacks the capacity to test hypothesis.
Okay.
So jump down, and significant level is not less than 0.05. It's equal to or less than 0.05. Next slide.
Ethical considerations. I'll get the ethical clearance.
UPTH might want you to get an ethical approval. UPTH might want you to get an ethical approval, but you get ethical approval from clearance from the University of Port Harcourt Research and Ethics Committee. UPH might give you permission or also request you to get an ethical approval, informed consent. Next slide.
The references.
All right, let's go back to your title slide. Uptake and determinant of hepatitis vaccine amongst health workers. All right. So it should be frontline health workers. Frontline health worker. Because listen to me. The gate man in the hospital is a health worker. The admin staff in the hospital, they are members of JOESU. You were in the same association with them now until recently. Joint Health Sector Workers Union. So they are health workers. Do you understand me?
Yes, sir.
So even the ambulance driver is a health worker. The security man is a health worker. So we need to define uptake and determinants of hepatitis B vaccine amongst frontline health workers or clinicians in University of Port Harcourt Teaching Hospital.
Okay, sir.
Frontline health workers or clinician, whichever one you choose. But the issue is that we are not going to worry about pharmacists because they don't take samples. They just attend to prescription. Their exposure to hazard is very low among the clinicians. Next slide. Their background didn't say anything. Very old literature. Next slide. You did not state any problem. Look at their problem statement. There is no data there. Nothing inside. That's why I say skip. Next slide. Justification. I don't see anything inside here. Next slide. Let's see our aim and objectives. People who like speaking grammar. The aim of this study is to assess the uptake of hepatitis B vaccine and its determinants amongst first-line clinical workers or clinicians in University of Port Harcourt Teaching Hospital. Are you there?
Yes, sir.
Now, the next one is the objectives to determine the level of knowledge of hepatitis B vaccination amongst clinicians in UPTH. Then two, to ascertain the attitude of clinicians towards hepatitis B vaccination in the University of Port Harcourt Teaching Hospital. The third one is to ascertain the level of uptake of hepatitis B vaccination amongst clinicians in University of Port Harcourt Teaching Hospital. Are you there?
Yes, sir.
Knowledge, attitude, and uptake. Now, the fourth objective is to identify the determinants of uptake of hepatitis B vaccination amongst clinicians in University of Port Harcourt Teaching Hospital. That's objective 4. Then objective 5, to explore the facilitators and barriers to the uptake of hepatitis B vaccine among clinicians in University of Port Harcourt Teaching Hospital. I've given you 5 objectives. Objective 1, knowledge. Objective 2, attitude. Objective 3, uptake. Objective 4, determinants of uptake. Objective 5, explore the barriers and facilitators to the uptake Are you there?
Yes, sir.
All right, so next slide. Study area is River State. Study location in University of Port Harcourt Teaching Hospital. Study design is descriptive cross-sectional study design that will use both qualitative and quantitative data. Hear me, oh. Descriptive cross-sectional study design that will utilize quantitative and qualitative data. Next slide. Study population, I've told you, is frontline clinical staff in University of Port Harcourt Teaching Hospital, whose activities have to do with blood sample collection, analysis, and collection of samples that involve body fluids. Are you hearing me?
Yes, sir.
So we have said that you must be a clinical staff, frontline clinical staff, must have been employed to work in the hospital for nothing less than 6 months. That is it. The other one is those who are too ill to participate. Consent is not a criteria for me. Next slide. Sample size, we have discussed this. You calculate, tell us the symbols. What does N mean? Z, P, Q, E, tell us what they are, and then calculate. Next slide. Then provide for non-response, and then provide for design effect. I've told you how to do the sampling method. You said there are 14 or 16 departments. So stage 1, select how many? Stage 2, select this, like that. Next slide. I think that's all. We have looked at all. I've given you the sections of the questionnaire. Section A, social demographic. Section B, occupational history. Section C, knowledge. D, attitude. E, optic. Is it not so?
Yes, sir.
All right. Then, like I said, we are going to have 2 tools there. A semi-structured interview administered questionnaire, as well as an interview guide. The interview guide will be for the qualitative study. You still need a focus group discussion of selected people from the departments to tell us how easy or difficult is it for them to take the vaccine. Are you hearing me?
Yes, sir.
All right. If you have any question, ask me. What is your serial number?
Number 11, sir. I don't have any question.
You are number 11. Who is your supervisor? Yeah, Rosemary Agalo.
Yes, sir.
All right. So stop sharing.
All right. Thank you, sir.
Akinde Love, Ayomide. Ayomide Love, are you there? Ayomide Akinde Love. Is anybody hearing me? Olajide, are you there?
We can hear you, sir.
Is Olajide there? Olajide, Ene, are you there? Ene, Goldbad Joseph, Tombara.
Yes, I'm here. Ene.
Tombara.
Good morning, sir. Tombara is here. Joseph is here.
Ene is here, sir.
Hold on. There is Gold.
Yeah, Joseph is here, sir.
Ene is here.
Tombara.
Sorry.
Yes, sir.
I was saying yes, sir, but I did not know I was
Joseph is here, sir.
Okay, stop talking. Who is Arok?
Sam, the one. And Aruk, Ene.
I'll share your screen.
Okay, sir. Okay, sir. Good morning, sir.
Hold on. How do you assess or measure retention in care? Ene,
Yes, sir.
put on your video.
Okay.
Put on your video. How do you measure retention in care?
By measuring retention in care.
Pull the laptop cover to yourself. Pull the laptop cover towards yourself. All right. I can
So
see
can
you.
you see?
Yes.
Okay,
You're looking
sir.
gorgeous. You're looking gorgeous.
Thank you very much, sir.
So how do you measure retention in care?
Okay, we measure by when you are initiated in HIV ARVs within the first 6 months of adherence to treatment.
No, that is wrong. That is not true. Retention is about
being in care,
remaining in care, keeping
yes,
your appointments, keeping your appointments.
Yes, sir.
So if you don't understand that, then you cannot do this study.
No, sir, I do. It's keeping to appointments and then not missing your appointments, sir.
So what's the difference between retention in care and continuity in care?
Retention in care, there is no much difference.
There is
continuity.
Much difference.
Okay, continuity is in care means that you were in care and then you stopped for a while and then you now continue.
No. Don't go there. Don't go there.
Okay, sir.
Don't go there. But present your work. Let's start.
Okay, sir.
I want to believe that you work in HIV program, and if you don't know
sir,
this,
I'm the prevention coordinator in my.
But you don't know much about what you are doing. That is the wahala now. That's the wahala now. Continue.
Okay. Determinants of retention in care of people living with HIV in Cross River State, Nigeria. What's happening? Sorry. Okay. Hello, sir. So can you hear me? The background of the information.
We're waiting for you to talk now. We are waiting for you to talk.
I think it's the network. The background of information. The global HIV burden. As of the end of 2024, approximately 39.9 million people were living with HIV worldwide, with sub-Saharan Africa bearing the disappropriate burden of epidemic. Over 2/3 of the global total. Joint United Nations Program on HIV/AIDS (UNAIDS) in 2025. The global response to HIV is guided by the UNAIDS 95-95-95 targets, which aim to ensure that by 2025, 95% of people living with HIV know their status, and 95% of those diagnosed are on ART, and 95% of those on treatment achieve viral suppression. Nigeria, the most populous country in Africa and home for the fourth largest HIV epidemic globally, presents a microscope of the retention challenges confronting sub-Saharan Africa, with an estimated 1.9 million of people living with HIV.
Next slide. You are counting your words. What is not good? And this is not even PowerPoint. This your work is not in PowerPoint. Your work is not in PowerPoint. Don't argue with me. Oh,
I'm so sorry.
If you argue with me, I'll just log you out.
I'm sorry.
I'm not dragging land with you. I'm not dragging anything with you. So I can't lie against you. If I say it's not PowerPoint, it's not PowerPoint. Continue.
Problem statement. Nigerian HIV burden. Nigeria has 1.9 million people living with HIV, the fourth largest epidemic globally. National pooled retention rate stands at only 72%, far below the 95 US target. South-South region.
Hold on. You have given me data that Nigeria has 1.9 million people living with HIV, and the fourth largest epidemic globally. You didn't tell me the source. You have said national pool retention rate is 72%, below 9. You didn't give me source. So this is not an academic writing. They're just talking without citing the sources of your data. Do you understand?
Yes, sir.
You have given data, plenty statistics, no reference. It can't work. Next slide.
The study justification. Critical evidence gap. No comprehensive study exists on retention determinants specific to
It's a
Cross
lie.
Rivers.
It's a lie. It's a lie. That's a big lie. You said Olawekpo et al. Gave this. So where did that information come from? Where did that information come from? Next slide, please. This is lie. Let's see our study of the aim and objectives.
The overall aim to assess the determinants of retention in HIV among people living with HIV in Cross River State. Objective, to determine the level of retention in HIV care among people living with HIV in Cross River State. 2, to examine the influence of social demographic characteristics on retention in HIV care among people living with HIV in Cross River State. 3, assess the relationship between knowledge of HIV treatment and retention in HIV care among people living with HIV in Cross River State. 4,
next slide. Next slide.
The study area and study design. Study area, Cross River State, Nigeria, located in South. The study population and selection criteria. General study population, target population, adults, people living with HIV, 18 years and above, adults age 18 years or diagnosed HIV.
Stop reading everything. Stop reading everything, because now you have to describe the study population. Now you have split it into target population and minimum enrollment. That should be part of the inclusion criteria. That minimum enrollment, that must be in. So now, if you are talking about minimum enrollment duration, 6 months, 6 months is not enough to determine retention in care. Retention in care is calculated based on the year, or in the last 90 days. Have you missed any appointment or something like that? Is it not true?
Yes, sir.
So why don't we take people who have been in care for at least 1 year?
Okay, sir.
Must be HIV positive, must be on ART in any of the treatment facility centers in this, must have been on ART for at least 1 year. That's what we should take. You are HIV positive, you have been recruited into care, you are placed on ART for at least 1 year. That's what we should get. Then exclusion will be those who are too ill to participate or those who have speech and hearing defect. Next slide.
Thank you, sir. The sample size.
No, you see, this is wrong. Like I told the last person, give us the formula, tell us the source of the formula, then give us the different symbols and what they stand for. Different symbols and what they stand for. P is the prevalence or proportion of the attribute of proportion of people who are retained in care from a previous study. If it's 58%, fine, write it like that. Then you now substitute. Substitute, let us see. 10%. You have to do the substitution, do the calculation, so that we see that show working. So that we know that you are not just lifting from somewhere. So 10% non-response, that's 374 plus 38. Does it give you 420? No. Then what about providing for design effect? You have to provide for design effect. Because you're going to use multi-stage sampling. Multiply the sample size by 2 or by 1.5. Are you hearing me? Or by increase it by 50% or by 100%. Next slide.
Multi-stage sampling methods.
Stage one, what did you do?
Stage one, the stratify local government selection. The 18 local government, 3 senatorial districts, 2
So how many did you select after the stratification?
6.
You selected 6, 2 per senatorial district?
Yes, sir.
So then the next stage is what? Which of the two local government you select? So what do you do with them for each of them?
We identify the accredited ART centers in the selected local government.
So how many are you selecting in each of the local government? Because each local government have up to 3 or 4. So how many are you selecting in each of the local governments? You cannot use all.
No, sir. We are selecting one each of the local governments.
So stage 1, stratify the local government to 3 senatorial districts. Stage 2, select 2 local governments. And then stage 3, identify the accredited ART centers and select 1 or 2.
One in the local government.
So you're going to have 6 ART centers. So these 6 ART centers, now you have a sample size of close to 600. So how do you get these 600 people? You have to look at their population of ART patients captured for care. And then do proportionate to size allocation of that into the tray. Then you use a systematic sampling method to select the allotted subsample on their clinic days over a period of 1 or 2 months, as the case may be. Next slide.
Study instruments. Structured.
What will the checklist do? What will you use the checklist for?
Okay, we are going to list out those that were on ART and then those that have missed their appointment like 3 times.
You meet everybody who is captured in the program for 1 year must be on ART. So that one you know. So it's not a checklist. It's not a checklist. A checklist is a list of items you check and crossfire whether they exist. They exist. So it's a structured or semi-structured questionnaire, interviewer administered. It cannot be self-administered. It should be interviewer administered. Do you hear me?
Yes, I'm writing them down.
Now, what are the sections of the questionnaire? Section A, social demographic characteristics. Write down. I won't
I'm writing them down, sir. Yes, sir.
Section B, medical history. Medical history. That is common health problems, whether they have comorbid conditions like hypertension, diabetes, this and that. Then section C is HIV history. HIV history. When they were diagnosed of HIV, when they were placed on treatment, the regimen they are on. Are you hearing me?
Yes, sir.
Then the occurrence of opportunistic infections. Then we look at their last viral load estimate. Then the section on retention. That is how they keep their appointments.
Sorry,
whether they have been keeping the appointments as recommended. Are you there?
Yes, sir.
So that is it. So we don't need anything on knowledge. We don't need anything on knowledge. Section A is social demographic. Section B, medical history. Section C is HIV
history. Yes, sir.
Section D, you have some medication adherence there, so we can do medication adherence. We can do medication adherence.
Yes, sir.
Are you hearing me? Using Morinsky's 8IRM medication adherence scale. Next slide.
Okay, sir. Data management.
No, you have not told us how you are going to collect the data. You have not told us how you will collect the data. Who will collect the data? And how are you going to collect it? You have not told us that. So tell us how many people will collect the data and over a period of what, and then whether they are going to be trained and what you are going to train them on and for what duration. That's that. Then for instrument validity is missing here. You should test for validity to know whether the questions mean the same to all the people. And you're going to use a pretest of a sample of minimum of 30 or 10% of the study population in a place we are not doing the study. Then Croback alpha test will be used for reliability. SPSS version 26, fine. Descriptive statistics, chi-square, yes. So p-value should be less than or equal to 0.05, significant level. Next slide.
Ethical consideration, ethical approval should be
Report, yes.
and then
They're going to
ministry
use health facilities. They're going to use health facilities, so they're going to get permission from the health facilities. They're going to get permission from the health facilities before you enter there to collect data. Then you get informed consent from the patients. So permission is missing there. Are you seeing it?
Yes, sir.
Next slide.
References.
All right. Now this is, hold on. Now this is the only references you have.
Yes,
I thought
sir.
you made so many references at the other place. I don't understand though. Now let's go back to the title. Quickly.
Yes, sir. Okay.
Now, when you look at determinants of retention in care, what is the significance of retention in care? If we are not just going to look at how many people were retained in care and how many people were not retained in care, what is the importance of that? We have to relate it to an outcome of interest. The outcome of interest is treatment outcome. Are you hearing me?
Yes, sir.
We should not only be interested. Osai, are you there or you have left? Osai.
Prof, I'm here with you, Prof. I'm listening.
Osai, you're a medical doctor, aren't you? What are you,
Prof,
Osai?
I'm here with you.
I'm asking you,
Hello,
what
Prof.
are you? I can hear you now. I'm asking what you are. Because I want to share something with you. You see, when you say determinant retention in care, if you are retained in care, and so what? That retention in care must reflect on something. So we cannot just have retention in care, assess it on its determinants. No, we must relate it to treatment outcome. If you are retained, and your treatment outcome is poor, what is the significance? You are taking drugs and then you're not getting better. Won't you leave the place? So we must look at it from a different perspective. Retention in care and treatment outcome amongst HIV patients in Cross River State. Retention in care and treatment outcome. Determinants of retention in care and treatment outcome amongst HIV patients in Cross River State. Determinants of what? Retention in care and treatment outcome. Yes. So having said this, let us go to the next slide. Next slide. I've told you didn't do any statement of problem. Next slide.
Yes, sir.
Objectives. Go to the slide on aim and objectives.
Sir, okay.
To identify the determinants of retention in care and treatment outcomes among people living with HIV/AIDS in Cross River State. Are you here?
Yes, sir.
So objective 1 is what? To determine the level of retention in care
and treatment.
No, wait first.
Okay, sir.
Objective 1 is to determine the level of retention in care of HIV patients in Cross River State. Objective 2, to ascertain the level of viral suppression. To ascertain the level of what? Viral suppression amongst people living with HIV/AIDS in Cross River State. Objective 3, to identify the occurrence of opportunistic infections amongst people living with HIV/AIDS in Cross River State. Objective 4, to determine the level of medication adherence to identify, to assess the level of medication adherence amongst people living with HIV/AIDS in Cross River State, or people living with on ART. Actually, it's not people living HIV patients on ART. All this one, HIV patients on ART.
Yeah.
Are you hearing me? Because
yes,
you might be living with HIV/AIDS, but you are not on ART.
Yes.
So objective 1, level of retention among HIV patients on ART in Cross River State. Objective 2, level of viral suppression. Objective 3, occurrence of opportunistic infections. Objective 4, level of medication adherence. Are you hearing me?
Yes, sir. I'm writing
Then
down.
objective 5, general health status of HIV patients on ART. And then objective 6, determine the level of the treatment outcome. Objective 6, to determine the treatment outcome among ART patients. Are you there?
Yes, sir. I'm here.
Then objective 7, to identify the determinants of retention in care. And then you're going to have even an 8th objective, but we can remove one of them. We can remove one of them. We can take away the occurrence of opportunistic infections.
Okay, sir.
We'll just put that one inside the questionnaire. We just put that one inside the questionnaire. Then objective 7 now will be to identify the determinants of retention, treatment outcome. Objective 1, retention in care. Objective 2, viral suppression. Objective 3, medication adherence. Objective 4, what is it? Objective 4, treatment outcome, Abi?
Yes, the level of treatment outcome.
Objective 5 is determinants of retention. Objective 6, factors associated with retention. Is there anyone I've left out?
No, sir. You said you should.
Retention is objective 1, viral suppression objective 2, medication adherence objective 3,
Treatment.
then treatment outcome objective 4, then determinants of retention 5 rather, and then determinants of treatment outcomes 6. All right. No, we have removed the opportunistic infection.
Opportunistic infection into the questionnaire.
We are going to put it inside the questionnaire alone.
Yes.
I don't want you to have up to 8 objectives. You say it's too many. All right. So next slide. So who is your supervisor?
Professor Bessa.
All right. Next slide. I think we have done all these ones.
Yes, sir. Yes, sir.
So do you have any question? Your serial number what?
14. N.A. Felix.
14. Okay.
Yes, sir.
Stop sharing. 15.
Thank you, sir.
Tombara Joseph, are you there?
Yes, sir. I'm here, sir.
Share your screen.